Tracheostomy suctioning procedure. Perform hand hygiene at the bedside. Check the expiration date, condition of packaging, and sterility of the suction catheter package and the normal saline. Identify the client using 2 identifiers, such as name, date of birth, or medical record number. Ask the client to state this information and verify with armband or the medical record. Explain the procedure to the client and allow the client to ask questions if applicable. Raise the bed to appropriate working height. Assist the client to either semi-Fowler's or high Fowler's position. Removing the pillow from behind the client's head may provide a more open airway to aid in maintaining sterile technique. Assess the respiratory status and vital signs. Apply pulse oximeter. Apply personal protective equipment as indicated. Connect tubing to the suction device and set to 80 to 120 millimeters of mercury. Connect oxygen to ventilation device and turn oxygen to 100%. Perform hand hygiene again. Place towel across client's chest. Open suctioning kit on bedside table. Set up sterile field and sterile basin from the kit. Fill sterile basin with 100 milliliters of normal saline. Avoid touching the bottle to the basin. Don sterile gloves. Pick up sterile suction catheter and wrap around your dominant hand. This hand will remain sterile throughout the entire procedure. Then pick up the suction tubing with your non-dominant hand. At this point, your non-dominant hand will no longer be sterile. Attach suction tubing to the suction catheter in your dominant hand. Keep the catheter sterile. Test the suction equipment. Place tip of suction catheter into sterile basin of normal saline and place the thumb or index finger of the non-dominant hand over the suction port to suction a small amount of fluid. Using the non-dominant hand, connect the ventilation device to the trach and hyperoxygenate the client for 30 to 60 seconds. Be sure to keep your dominant hand sterile. Without applying suction, quickly insert the catheter until resistance is met. Then pull back 1 centimeter. The client may cough when resistance is met. Apply intermittent suction with the non-dominant hand while withdrawing and rotating the catheter in a circular motion with the dominant hand. Apply suction for 10 to 15 seconds. Be sure to hold the catheter carefully as it exits the tracheostomy site to prevent uncontrolled movements of the catheter and potential contamination of the catheter or surrounding areas. Observe client for respiratory distress. Hyperoxygenate the client using the non-dominant hand. Allow 60 seconds between suction passes. Clear the suction catheter with normal saline from the basin after each pass. Keeping the suction catheter sterile throughout the procedure. Repeat suction if needed for 1 or 2 passes. Then reassess to see if more suction is needed and allow patient time to rest more before repeating the suction pass. Hyperoxygenate after each suction pass. Clear suction tubing with normal saline after each pass and after the last pass. Remove gloves, wrapping catheter inside. Remove remaining PPE. Dispose of used equipment properly. Perform hand hygiene. Reposition the client to a comfortable and safe position with call light in reach and oxygen ventilation resumed as indicated. Reassess lungs, vital signs, and respiratory status.